Hi, everyone. My name is Noah Flaherty from Vellum, and thanks so much for joining me here today with Prithvi from Rely Health. Today, we're going to be talking about AI in healthcare and how Rely Health, really what their playbook was for building fast, safe, and secure AI healthcare solutions. Thanks so much for joining. And once again, thank you to Prithvi for being here. We'll do intros in just a second, but some quick housekeeping items before we dive in. I just want to note that we would love kind of Q&A, and we'd love for your questions to be asked. We're using Livestorm for this, so feel free to put them into the chat. We will be answering them to the end, though, so bring them in. Sharon's here with us. She may be answering some of these questions through the chat, but I suspect we'll save a good 15 minutes or so towards the end to answer any that are remaining. I also want to note that a copy of these presentation slides will be shared with you after the presentation or after the session, as well as a link to the recording. So by all means, take notes, but know that all of this will be accessible to you later as well. So the real meat of all this, we will be talking about the original challenge and what it was that Rely Health set out to build. We'll have a walkthrough of how they went about approaching the problem, how Prithvi and his team built the solution. He's so kind to share a live demo with us of how it actually works and the nuts and bolts of it all, which I think will be interesting to a lot of you. And then, of course, that Q&A at the end. So with that, again, my name is Noah Flaherty. I'm CTO and co-founder here at Vellum. At Vellum, we are a platform for building AI solutions in the enterprise. So for everything from experimentation to evaluation, deployment, and monitoring, we help larger companies and cross-functional teams build and user-facing applications through the Vellum platform. And I'd like to welcome Prithvi to introduce himself.
Thank you, Noah. I'm Prithvi. I'm CTO and co-founder here at Rely. At Rely, we're building hybrid human AI outreach programs to support care coordination and navigation. We work closely with various entities from health systems and payers and public health entities across the country. Today, I'll walk you through one specific challenge we had in building reliable AI-driven outreach and why we chose Vellum as a core infrastructure partner. Through that, you'll get a real sense of how we built our AI phone system, how it supports our care navigators, and really the problem ultimately tackling here. Let's take one example to start with, really, the area of emergency room discharge navigation. These are patients that are leaving the emergency room every single day with broken bones, diabetes crises, psychiatric needs, substance use disorders, and so on and so forth, and there's no one to follow up with them. Health systems are very quickly realizing that emergency rooms aren't just high-volume entry points, they're also massive opportunities for patient retention and engagement. But staffing is a massive challenge. Over the past 5 years, we've supported over 50 emergency room departments across the country, and we've learned that there will never be enough human capacity, care navigation, social work capacity to cover everyone. And that's really where AI can step in, not to replace humans, but to augment them. And with Rely, we design AI discharge agents that can call, engage, and really triage at scale, and only escalate to when a human's needed. And over the past couple of years, by using AI, we've seen that our navigators are 10 to 15x more effective than the rest of the market. I mean, they can speak to 10 to 15x more patients and reliably navigate them, just given that AI augments so much of the work they would otherwise be doing.
Amazing. So you're taking these like people with domain expertise, you're making them like giving them superpowers with AI, and ultimately it sounds like helping them reach more patients than they ever could have otherwise, while still providing them with like the level of quality care that they deserve.
Yeah, and not just reach them, but also really just navigate them, get them to the right follow-up appointment, get them into rehab, get them transportation services. There's so much involved that our navigators do, and we're really able to supercharge them thanks to AI. And really that speaks to our mission. Our mission is really just labor transformation. We believe that the future of healthcare depends on supporting roles like navigators, discharge coordinators, and front office staff, and really empowering them with the tools they need to do more and to do better, right? These folks come into the health system really wanting to help patients as much as possible. And for the most part today, they're bogged down with paperwork and just manual tasks that they take most of the day, honestly. Mm-hmm. And these roles are really the backbone of the healthcare system. And we're just really building AI to help them, not replace them, and just augment them and make them better at what they do.
Super cool. So, for those of you out in the audience, I can imagine that there's, some fraction of you that are in the healthcare space and you're trying to think like, how can AI be applied to my domain? I think there's a lot of exciting stuff that you'll hear here. The example that we'll be talking through is this kind of like voice-based phone healthcare outreach system. So that'll be super interesting. For those of you that are building with AI, but not necessarily in the healthcare space, I think there's going to be a lot of analogies you can draw between healthcare and really any other highly regulated industry where the cost of being wrong is really high, or the kind of the rules that you have to work within are high, or the need for data privacy and security are high. So my hope is that there's a little bit of something for everything in here. With that, though, let's start talking more about, Prithvi, like really the problem that you set out to solve and your solution to solving it. Just to ground this for everyone else, though, I think it would be really helpful to kind of like lay out the problem statement and what the end like user-facing application feels like or is meant to do, so that once we go in and see how it's built, we'll all be on the same page.
Yeah, absolutely, Noah. So what we're going to do is we're going to show you a live demo of two pieces. Number one, our platform and how our navigators engage with patients. And number two, the Vellum side of things, how we leverage Vellum as really that infrastructure powering a lot of the work that we're doing. We use Vellum in three ways: observability, traceability, and evals. So what we're going to show you is a quick demo of what our entire system looks like in practice. Typically, the average case manager, social worker, or care navigator would spend maybe 50% of the day making calls out to patients that they've previously met or are on a list that they're given. And they make these calls, leave voicemails, try to reach them, coordinate transportation, other follow-up care, so on and so forth. What we've done is we've leveraged an AI phone call system to automatically call patients using custom scripts, basically tailored to the needs of those individual clinics. And one of the critical things you'll see here is that reliability is paramount. We cannot call a substance use patient and have the AI hallucinate and speak something or whatever. If a patient's, God forbid, suicidal, we need an escalation immediately. We can't wait for a tool call to potentially work the first time and not work the second time or whatever else. We don't have that luxury of, like, for example, an AI SDR might have, of basically making some mistakes sometimes and allowing those mistakes to come through. We have to be very accurate. And finally, the health system needs to be able to audit everything we're doing. That patient's doctor, who they saw in the emergency room, might want to know if any follow-up steps were taken, so on and so forth. So we need to generate incredibly accurate, structured JSON summaries to capture exactly what happened and provide a clear and actionable record. In addition to that, when the AI is taking the call, if the patients need something as a follow-up, someone's going to have to make that follow-up. And that's also just critical to our entire piece here. So yeah, that's a high-level overview. We're going to go over how our voice agents work within tailored workflows, how we generate JSON outputs, and how we use Vellum to observe, understand, improve, and debug these systems over time.
Super cool. And Prithvi, one thing I'll observe for those that maybe are listening but not in the healthcare space is some like really common ingredients of what you just said that I've seen in a lot of other companies is one, you have a need for low latency, right? Like these are voice applications at the end of the day, and you want the AI to respond quickly. Two, you can't afford to be wrong. Like if you need to escalate to a human, like you need a all the time, like you want to err on the side of caution and escalate more often needed, and false negatives are like potentially really bad. Also, you need auditing and knowing exactly what the AI did at every step of the way and being able to like, diagnose and audit and see exactly those steps. And then finally, there's like a structured data extraction step of this too, which is you want this nice, clean JSON output that a doctor or somebody can, action later. So lots of, I think you'll see those ingredients in a lot of different industries, and we see them all become relevant here in healthcare.
Absolutely. Yeah, so what we can do now is we can hop into a demo of...
Yeah, let me stop sharing and we'll let you share. And I just want to say thanks so much for being willing to show kind of the internals, how things work. And I guess for the audience, Prithvi was kind enough to put together kind of like a agnostic version of this such that there's no sensitive data being exposed. And so we'll ask for your patience as we pause and stop screen sharing and resume screen share so that we can navigate and show you only what we intend to show.
Perfect. Yeah, so over here we have the system that our navigators use to engage with patients. Now, typically, phone calls go out fully autonomously. Navigators are notified when anything goes wrong, and they hop into the call. Or they use the system to sometimes make calls manually to patients as needed. In this particular demo, we're going to have me engage with the AI system all through the browser. So it's not fully reflective of what happens with the navigator, but it's pretty close enough that you'll be able to see a lot of the intricacies and moving parts.
Yeah, I just want to point out, it's cool that you have this like AI-enabled test mode. I think there's a lot of people thinking through like how do you make UIs and kind of like interactive. How do you test AI as you're building it? And I think this is a cool lesson to those out there that want to build sandbox environments to test their own product and the AI that backs it. So just already a cool observation to me.
Yeah, absolutely. And I mean, we make dozens of these test calls, and you'll sort of see throughout the process how the test calls and the data that we get from these test calls gets directly piped into Vellum, used for evals, and that entire pipeline.
Super cool. That's
Perfect.
it.
Yeah, so I'm going to go ahead and make this call. And again, I'm going to be talking to the AI through the browser. So you're going to hear the AI, and you're going to hear me respond.
Thank you for calling Flint Hills Family Health Center. I'm Sam, an AI care navigator. To get started, I'll just need to collect some basic information. Can I have your first name, please?
Yeah, my first name is Prithvi.
Thank you, Prithvi. And your last name, please?
Narasimhan.
Thank you, Prithvi Narasimhan. And what is your date of birth?
My date of birth is December 24th.
Thank you. And which clinic location did you visit?
I'm talking. I think the one on Tulsa.
Sounds like you might mean the Flint Hills Family Health Center, Crestview. Does that sound right?
Yeah. Sorry, Crestview. Yes, that's correct.
Got it, Crestview. All right. How can I help you today?
Yeah, I needed help making a follow-up appointment with my primary care doctor. Is that something y'all can help with?
Unfortunately, I can't schedule follow-up appointments directly after hours. You'll forward your request to the appropriate department, and they'll contact you within 1 to 2 business days to assist with scheduling. Is there anything else you need help with?
I guess what else can you help me with?
I can assist with booking referrals, answering general clinic-related questions, or forwarding messages to the appropriate department for things like billing, insurance, or medical records.
Oh, yes.
Let me know if there's anything else you'd like.
Right. I did need a referral. Can you help me send over a referral to the orthopedic clinic for my elbow injury?
Of course, I can help with that. What days of the week work best for you for the referral appointment?
Monday, Wednesday, Thursday. I'm pretty free after 3 p.m.
Thanks for sharing your availability. Do you prefer morning or afternoon appointments?
Morning. I actually have a very serious headache, and it's given me like these suicidal thoughts lately. So yeah, I mean, morning would be fine, but it's been pretty serious.
Redirecting you to the Molina nurse hotline.
Thank you for calling Molina.
Perfect. And we might have
What did we just see, Prithvi? Was that a human talking to you?
Yeah, that was an example of our AI call. So that was me just engaging with AI, having an open conversation, pretending to be a patient, and you can sort of see how the system responds, so on and so forth. What I'd love to do,
just like observing that, it was really cool to me to see, like, of course, like at the end there, that the immediate escalation as soon as they saw something dangerous was seen, but also like you were interrupting, you were kind of like providing filler words and ums, and it still got to the bottom of it. It asked clarifying questions, a lot of like really, really cool interactions.
Yeah, absolutely. And what I'd love to do now is just go through how these interactions actually work on the back end, so to speak, reveal the curtain a little bit and show you all where Vellum is playing a role in this. But yeah, we can start off with the transcript. So we're just going to go to the top. Over here, we have these different monitors. So we have like these various different pieces that monitor the call and let the navigator know when something goes wrong. That's like part A. We'll go over that in a minute. And as the call goes through, you'll see there's a transcription being generated over here. At the end of the call, you'll see there's a Vellum execution here. And so what we can do is we can actually just click on that information icon, go to this particular URL, and sort of what Noah, you alluded to earlier, we make these test calls, we make dozens of them. And we want to be able to get this data into our eval set so we can make these prompts better and better over time.
Cool. Prithvi, you'll probably have to share your other tab here once you get to that URL.
Yep. And I'm
so basically like you got this execution in your UI, and now you're going to like go and see exactly what happened behind the scenes.
Yeah, so here we have the Vellum platform, and you can see that the call we just had gets piped in to this particular deployment as an eval or as an execution. And what we can then do is we can look through the transcription history, understand what's going on. Typically, our navigators, after they make a call or see a call or help test our calls, rate the quality of the calls in our platform, but they can also go in over here and indicate whether the output was good or bad, allowing our content engineering team to really understand which calls to focus on. And then if the call has an interesting edge case or something else that we want to keep track of in the future, we can then go ahead and save this as a test suite, adding it to our eval suite so we can basically continuously integrate prompts and understand and make sure that things aren't breaking whenever we make those updates.
So you had that interaction, you're in your UI, you hopped over to this execution. Here you can see details about it. And then you can like crucially save it as an example that you want to use as an input as you continue iterating on this workflow. So let's say like it produced an output that you weren't expecting. You might add it to your test suite from here and like iterate until it works now. Is that kind of what you're saying?
Basically, pretty much.
Okay, cool. So you've added it to that test suite. Let's see the prompt that's driving this thing now.
Yeah, absolutely. I'm just going to go ahead and navigate to that page. Yeah, so here we have a simple prompt, just taking care of this demo phone call. And what we do typically is one of the tricky things with AI phone calls is we can't use like the top of the line reasoning models. Latency is critical here. So we end up having to use models like 4.0, 4.1, and models that basically have that focus on high latency, low latency, but sometimes don't tend to instruction follow as well. So part of that is every single small change you make to the prompt can break everything. I know a lot of folks talk about composability and different things in prompting, and we do all of that, as you can see over here. But despite following those best practices, we still have these issues where we make like a 2-word change somewhere, and then this random edge case where a patient asks about some esoteric insurance plan, then randomly breaks. And the only way to really solve for that is through those evals and through really rigorous continuous integration practices throughout the entire process. We get thousands of these, like tens of thousands of calls per month now, and there's no way we can humanely like keep track of all the random edge cases going on. And previously, this was all built into our system, and we had to literally manually retest everything every single time. It was
that's brutal.
Yeah, it drove the team crazy. And over the past couple of months, 9 months now, I think we've been using Vellum, and yeah, it is easier. We press play and it tests, and I can actually pull that up. Let me go ahead and share the screen of the evals.
Cool.
So here we have a bunch of evals we have for one of our example calls. So you can see over here, we literally try to test every single edge case imaginable. And on this specific one, we don't even have that many evals. We typically have way more because we have this very quick and easy process to export, import evals, add existing phone calls to evals, and just have that process really tied in.
Cool. And so what are some of the things that you're looking for in this particular eval?
Yeah, in this particular eval, I mean, every single time we make an update to any prompt, we run each and every one of these edge cases regardless, just to make sure that everything is still up to par. As I mentioned earlier, minor prompt changes can make a big difference. So we have basically a simple eval metric where we specify, we use an LLM as a judge here, and we tell the LLM as a judge basically what to look for. This patient should be seeking emergency services, or the AI should mention the patient needs to seek emergency services if a medical emergency is spoken, for example. Or they should ask the patient, an agent should ask the patient which clinic they visited again in this particular scenario, because I'm guessing here, this patient did not confirm the clinic they visited.
So to make sure I understand, you have this like bank of, it looks like 111 test cases. And anytime you make a change to your system, you want to rerun it against these 111 test cases. And for each test case, you're providing an example conversation between the human and the AI. And you're using LLM as a judge to perform an evaluation. And for that LLM as a judge, you're telling it what the original AI should have done. So for example, if you scroll up in for this row, it looks like your LLM eval rule says, should ask patient again which clinic they visited. And so when you run this test suite, your prompt produced this output that says, I understand you'd like to reschedule an appointment. Before I can help with that, blah, blah, blah. And it is producing a score of true, saying, yes, it did follow these rules.
Exactly.
Pretty cool.
And this is just one of our eval suites. Typically for calls, we have multiple of them. We have one that might be only looking exclusively for LLM as a judge. Is it outputting the right stuff? We also use tonality, for example, to make sure that the right tone of conversation is being outputted by the LLM. We don't want the LLM to sound aggressive if the patient gets mad at the LLM, that type of thing. So really just covering our bases with all those different edge cases.
Okay. So you have your prompt, you run it against evals, it's better. Now I assume like redeploy it, and now you have the new prompt that's live or the new workflow that's live. You're collecting new calls, you're collecting new data, you see new edge cases, and you rinse and repeat.
Pretty much, that's exactly our new workflow. And this is like one part of our process. The second part of our process when launching an AI phone call is making sure that we are monitoring our executions correctly too. And this is really critical, especially in healthcare. For example, if I was having a regular old conversation with the AI and I said, yeah, I'm having suicidal tendencies because of blah, blah, blah. And at that point, we need from a liability perspective to redirect back to a certain hotline or to tell the patient they need to hang up and call 911, so on and so forth. In this dummy call, I made it redirect to some random number. I'm not really sure what, but that was just an example. Typically, we have strict policies and procedures in place. There's a lot of compliance behind all of this, and we can't necessarily trust tool calls. So here we use Vellum workflows, which is a separate tool altogether to help us basically orchestrate how these different agents work together. I'm going to go ahead and share our screen back in our system and then show you how we get to the Vellum workflow.
Okay, so far you've shown us kind of like the entire life cycle for a standalone individual prompt, but I think what you're saying is that the AI system that backs this whole phone calling agent is actually quite a complex beast that has, is using different prompts and different steps and the orchestration across them to produce the behavior that we're seeing right here. Mm-hmm. And that's what you're going to show us?
Exactly. And this really speaks to what our clients and customers need. Incredibly high levels of reliability. AI is still very nascent, and we're here talking about patient lives. We do not mess around with this at all. We want to make sure that we cover all our bases that we have, and we cannot trust patients' lives with probabilistic responses like that. So we take that part really seriously. We generate hundreds of evals for every conversation we have, on top of also using these other agents, as we call them, to monitor the call the entire time. So here we have an example of it is suicidal, patient being triggered, right? I just said, hey, there's a headache. It's giving me suicidal thoughts lately. It might have been, I might have even said something totally different. Like, yeah, it's making me feel like I'm losing the will to live or whatever, so on and so forth. We want to capture all of those different edge cases and immediately flag someone on our team and alongside take the appropriate actions and steps, like, for example, redirecting to a hotline if that's what the client requests or whatever else, to make sure we have that reliability. So here you can see, I'm just going to click on this information icon here. You can see there's a Vellum workflow that we have where we know the patient's suggesting suicidal ideation or self-harm. We can take a look at what's happening within Vellum. And I'm going to go ahead and share that tab separately in a sec. Yep, so you can see over here, this is an example of a Vellum workflow where we take that conversation history that we have so far. And let me just go to that is suicidal node. That should be right over here. Yep. We just have a simple prompt to determine whether or not this patient's suicidal. Again, this is a test phone call, a test workflow, test everything. So this isn't nearly as robust as we usually keep it. But you can see this is a simple prompt here, just verifying, like seeing if the patient's considering suicidal harm or not. If they are, output true. And then that hooks into our system. So we actually trigger a full set of audit logs and workflows where when we get a response from this workflow stating that this patient is suicidal, we can immediately get flagged and take the appropriate actions. Now, the neat part about this workflow is we actually have multiple different prompts over here and working in parallel. We have this first prompt over here that uses a chain of thought output, like using thinking tags, so on and so forth, to output whether or not the patient's suicidal. We have a second prompt that, based on if the patient decides that they're suicidal or not, generates a summary of the situation so our team can be informed or the appropriate member can be informed. And we also have prompts for different cases, like angry patients, for example. We want to understand when a patient's angry. We have a separate prompt that runs for that. So you can see this ran in parallel to this. This was true, this was false. So we're able to orchestrate sort of like dozens of different agents that monitor in the background every second of the call to just understand exactly what's happening throughout the entire conversation. One thing that's been really useful for us actually is cost tracking. You can imagine we're running like, I don't even know how many prompts a second during one of these calls. So we're able to actually keep our cogs in line by understanding how much it costs per minute of the call through Vellum.
Cool. And so if you zoom out, what we're really looking at is like the kind of the bird's eye view of all the different interactions between multiple different prompts in order to like produce the end experience that you just demoed to us.
Yep. And just like with the prompt, whenever we go live with a customer here, we have hundreds of test cases for each and every one of these agents. So we know for a fact that there's a high, extremely high likelihood, as high as we can get with AI, really understanding that, yeah, this patient's suicidal. We can flag that. We can capture that. We can take the appropriate steps. They have a medical emergency. We can tell them, please hang up and call 911 immediately. So these are really important cases, especially in healthcare when dealing with patient lives. And that's where the evals, along with the workflows, along with multiple prompts, come into play. Okay. I'm sure a lot of you, sorry, go ahead.
I was just going to ask Prithvi, like, if let's imagine you got a thumbs down on one of those outputs and it said that like, hey, it should have classified this conversation as angry patient, but it didn't. What would you do next?
We would then go ahead and make updates to the specific workflow. we have the prompts right over here. We just go and update the prompts and then add a couple new test cases based on our internal like judgment on what could happen in the future, and just run all the evals, not just the previous, not just the new evals, but the previous evals, to make sure that there's no regressions anywhere else. And one of the nice parts of that workflow is we talked about with the AI phone call, latency being super important, composability being super important, so on and so forth. We don't have to bother with composability here in that same sense, because we just literally have different prompts, and we can make sure each prompt is specifically tailored to one task. So there's a lot less worry about hallucinations. LLMs are great at classification. That's a massive, like, they're really good at classification in general, right? And we're able to leverage that advantage over here. Just having
cool. So like this process occurs, you branch out, you run a bunch of prompts in parallel. Certain prompts are classifying for certain things, and as they happen, you're triggering the UI to display different things, basically. Super cool. What else do I want to dig into here? Who is it that's typically making changes to the prompt?
Yeah, so we previously had a team of engineers just working on the infrastructure to make any of this possible. We were doing this internally, and we had workflows built out in some way, shape, or form internally, which required a lot of maintenance, so on and so forth. But with Vellum, we've been able to really empower our content engineering team to go in and take control of these calls end to end. So our content engineers, some of them are former care navigators too, who were a couple of years ago care navigators, and were able to build that technical skill set to really deep dive and use that knowledge of being that empathetic care navigator and bring it to the table with AI, and almost product managing the AI in a sense to tell it what to do.
Okay, so there, you have people that come from a healthcare background that are going into the Vellum UI, making tweaks to prompts, running it against the evals, confirming that it still works, and engineers are helping them to like scaffold out these systems and then deploy the changes as they pass evals, basically.
Exactly.
Cool. Is there anything else that you want to show us here in the demo, Prithvi?
Yeah, we could go over auto charting if time permits.
Yeah, I think we've got some time. I think we'd love to see it.
Cool. Let me go ahead and share my screen again. Cool. Yeah, so we went over the transcript, and now we're going to go over what happens after the call occurs. So you can see over here, we're now, based on the transcription, collecting various parts, different information, like the patient's first name, last name, date of birth, and so on and so forth. And we're also prioritizing the call based on how actionable it is. In this particular call, the patient not only needed an appointment, but they also mentioned they had suicidal tendencies. So because of that, we set a really high priority reminder for the team to act on it within the next, basically 0 days, within the next hour. Like they need to act on it, make sure the patient gets the appropriate triage, so on and so forth. So you can see over here, this is like the auto charting output that we generate. Again, like with those previous conversations, we can just go here, copy prompt, and we can go and view the Vellum workflow that's executing all this in the back end. And I'm just going to go ahead and share my screen onto that. Again, over here, we're using that composability property of Vellum workflows to really allow our content engineers to deep dive and make sure that we're getting accurate information about every property. We want to make sure that we're able to generate not just one good data to go in the EMR and good data for action items on top of it, but we also want to make sure we have robust analytics that our customers can then use to understand what's happening with all these different calls. We're sending out, like I said, in some cases, thousands of calls a day. And in order to really effectively capture what's going on, it's absolutely critical for us that these individual data points are collected in an accurate way so that our customers can have faith in the idea that our analytics is actually reliable and accurate for them. So you can see over here, this is one example of a prompt, message priority parallel, just determining the message priority. And yeah, we generate this output that then gets piped into our system so that our navigators can then interact with it, engage with it, understand what's going on with the patient, so on and so forth. One of the examples we can go through here is we can actually just go through how to edit one of these prompts and what that entire experience looks like. So I'm just gonna
kind of the flow I'm thinking is like you're in your UI, you're like, cool, let me look at this execution. You hop over here, you see it, you're like, all right, yeah, the workflow didn't quite do what it was supposed to. Let me go and try to make it better. So while Prithvi pulls this up, one of the premises behind workflows here is to help the orchestration of multi-prompt systems and kind of like reduce the time in the feedback loop between making a change, running it, and seeing the impact.
So that same example I just showed you earlier, here's what it looks like in the backend. Over here, we're going to go to that message priority parallel node that we were showing you earlier. And I'm just going to go ahead and make a minor edit to that particular node. We're going to basically make it so that if a patient says they are suicidal, it labels the message priority as suicidal. Again, might not make too much sense, but we're just doing an example here. I'm just going to write something. It hopefully works. If it doesn't, we typically have a much more robust prompting process beyond this example.
We'll cut you some slack. We're on a live demo here, Prithvi.
And if patient says. Great, and I'm just going to delete this from here. And let's just update the model for fun, I guess. Great, and I'm just going to go ahead and run this one more time. And now we'll see that this will output, hopefully suicidal. And no, it outputted medium. Well, anyway, unfortunately, that didn't work.
I think that kind of proves the point, right? Like you can never really expect what the model is going to produce until you actually try it. And so being able to like make a tweak, run, and then immediately be like, oh, shoot, it didn't do what I expected. Let me tweak it again. That's kind of the whole point, right?
Yeah, and this is actually a perfect example of that where we really want to make sure our systems are reliable for our customers. So yeah, customer might tell us, hey, like label this as suicidal. It might work in 1 or 2 cases, and that's great. But then in this random case, when a patient had an appointment and then at the end of it said they were suicidal or whatever, then it suddenly just doesn't work. It suddenly outputs medium instead of suicidal. And so this is the type of area where we're able to go in and actually make those updates for our customers and test them robustly with a bunch of evals.
So I guess for those listening in, like instrumenting the tools such that you can make a change, run things, immediately see that change, validate whether or not it did what it was supposed to. That's all good as part of the iteration process. But even after you've done the iteration, you want to be able to rely on evals and running against those 111 or maybe thousands of test cases to make sure you didn't regress in some other dimension where, just like we saw here, like the AI behaves, counterintuitively. So yeah, really appreciate you sharing all that, Prithvi. Really cool. Really cool to see like both the end result, but also what backs it all,
Yeah. And this alone would probably take navigators 3 to 4 hours a day, just making these outbound calls, checking in on patients at a very high level. And now that time is basically fully automated. So our navigators are really able to focus on those patients that need more help. Reaching out to substance use patients, checking in on them, making sure they get into rehab, building that empathy and that relationship with them. That's only possible now because our navigators have so much of extra capacity, thanks to the work that AI does, almost for them, but really with them.
Yeah, super cool. Let's see. If you were to kind of like give some words of advice to those earlier on in their adoption of AI within healthcare, like any 1 or 2 lessons that you think would be worth sharing?
Reliability is paramount. I mean, this goes without saying, almost in healthcare, you don't want to mess things up unnecessarily. You don't want to tell patients things that might lead to like potential medical harm or whatever else it is, right? So reliability is really, really paramount. But I think the other thing that we've learned is that AI is a good co-pilot. It's not a drop-in replacement. The interesting thing about healthcare is, yeah, you can make 1 million AI calls to some population, and that's great. But now someone needs to triage those calls on the back end. Someone needs to figure out what's going on. Someone needs to make those next follow-up steps. So it's not just one AI agent. I mean, that part's sort of the first easiest part of the entire situation. It's how do you orchestrate these agents together? How do you build out connectors so that a human might come into play, or an AI might hand it off to another AI. We might have multiple workflows. That's an example of where those workflows really come in for us, where we're able to build out these chains of agents. And that's really what we want to do at the end of the day. The healthcare is so complicated that you can't just plop in AI and expect magic to happen. You're going to fix one bottleneck, and you're going to create a bottleneck right down the line. And someone's going to have to pick it up. And in our case, we have our navigators to really help pick that up and make the AI effective. But yeah, deploying AI just off the bat is incredibly difficult in healthcare.
Yeah. Super cool. Thank you so much for sharing. Let's see. Last thing I want to tap into here is, you have at the end of the day, like this really interesting, like voice and speech use case. Like it's a calling agent at the end of the day, and you're using text models, and that's there's different approaches and different architectures to these like speech-based AI systems. Some people prefer to go for like the more voice to voice. Some people are doing like voice to, or like speech to text to text to speech. Curious, like what some of the trade-offs were that you were thinking through and why you ultimately went with the path that you did, which from the demo seems like it has like works quite well.
Well, the evals guided us. We went into Vellum, we toggled a couple different models, and one worked, the others didn't. But at the end of the day, I think it more came down, evals. That matters a lot. We want observability. We want to know what's happening. We want to make sure that the call, as much as we can, is scripted in a way that doesn't hallucinate. We want to understand exactly what's happening. And it's really hard to eval those real-time voice models. It's just really hard because it responds based on annotations. It responds based on the way the patient's talking. There's so many other factors at play here. We just found it a lot easier to eval and grasp what's happening with one of those models where, in that second case you brought up, the TTS, we get the text fatigue-gram, we speak it out with 11 labs, and we use the really the prompt and the evals to run the actual conversation.
Makes sense. So it's like, when there's text in the mix, it's both easier to like grok what it's doing, evaluate what it's doing, but also like steer and control what it is that it's doing.
Exactly.
Cool. All right, Prithvi. Well, thanks so much for sharing. If I was to just throw up a final slide to kind of sum up where we are, I mean, this is the approach, right? Like you've got this adaptive AI that works for a variety of different clinics. It's not like super tightly coupled to just one. You've got the monitoring and visibility needed to know what's happening within a call end to end and see that audit trail of what happened. You're dealing with both structured and unstructured data, but I think maybe most crucially at all, you're delivering this level of reliability at scale. It sounded like you're dealing with on the order of thousands or tens of thousands of calls a month, which is a pretty cool level of scale where being right really matters and being fast really matters too. Anything that you'd want to add here?
Yeah, no, I think this really sums it up. The voice agents is just one part of the workflows that we automate for using Vellum and using orchestration in general for our navigators. And there's just so much more to it too. So really, I think it's like you start with AI in one place, you find new areas to pop in, and you just keep going deeper and deeper.
Yeah. The use cases kind of like unveil themselves once you get in there.
Pretty much.